Good afternoon, hello, and welcome to the webinar series on COVID-19 organized by IQAC, Sri Venkateswara College, and All India Institute of Medical Sciences, New Delhi. I am Dr. Vartika Mathur, Assistant Professor in the Department of Zoology and IQAC member at Sri Venkateswara College, and I will be hosting the webinar series along with Professor Ambuj Roy, renowned cardiologist in AIIMS, New Delhi. In the last couple of months, a lot of information has been bombarded to us about COVID-19, and together with the stress of the lockdown, our own panic and uncertainty about the disease, as well as the lack of physical activity, we all are feeling a sense of despair and confusion. The purpose of this webinar series is to directly talk to the experts who are fighting in the front line with this pandemic so that we are better prepared for dealing with this situation. Today, in the first webinar, we have with us Professor Randeep Guleria, Director, All India Institute of Medical Sciences, and a renowned pulmonologist as well as the key member of National COVID Task Force. Sir will clear many myths surrounding COVID-19 that are being spread through various social media, and because of lack of authentic information, we tend to believe them. So if you have any questions or confusions that you would like to clarify with Professor Guleria, please do type them on the live chat box and Professor Ambuj Roy and I will ask them on your behalf. With this, now I request Professor Guleria to enlighten us with his talk on COVID-19, breaking myths and moving forward.
Hello everybody, I shall be talking regarding COVID-19 and the common myths and the way forward. Tall tales or true stories. COVID-19 is something which has hit the global community somewhere around last year. The pandemic, the virus has come into as a human-to-human virus, and over the last few months, it's created a large number of cases and deaths globally. A lot of myths have actually emerged because of this viral infection, and I'm here to just answer some of them, and I'll be very happy to answer questions after this presentation. So the first thing, when you start off with talking about COVID-19, some people argue that this has been around for a long time and this is not a new disease. It's important to understand why are we saying that this is a novel virus and what is so unique about it. Coronavirus is not a new viral infection. That is true. We've had SARS infection way back in 2002, 2003, and since then it's been recorded that more than 7 coronavirus illnesses have happened in human. 2 of them have been more serious, the SARS one and the MERS coronavirus. Others have been very mild. But this is a large family. COVID-19 is a new coronavirus which has emerged from animals and has jumped species and has become a pandemic because this virus has also developed the ability of good human-to-human spread, which many viruses are not able to do and therefore are not able to sustain themselves for a long time. So this is a new disease. This fact or this myth that this is not a new disease is not true. It's also important to understand that because it is a new and novel virus, we have no inherent immunity against this virus. Humans or mankind has no immunity, and thereby we are more susceptible to infection by COVID-19, and that is why so many cases across the globe have been infected by this new or novel coronavirus, which has been called as COVID-19. Coming to the next myth, and that is that the virus does not exist. It has never been isolated from human body. Again, this is a myth. We have now enough evidence to suggest that this virus, which is a virus which has these spikes or crowns around its on its surface, which gives it the name of the coronavirus, has been there. It's been isolated by many countries, including India, and this virus has been shown to be a novel and new virus which does exist and has been isolated from swabs from humans. It's also been isolated from fecal material from infected patients. So this virus does exist in the human body. There is also this myth which goes around that this virus is man-made, that this virus actually started from a research laboratory in Wuhan, and that's why this is so virulent. Again, this evidence is there is no evidence to really support this. If you look at the data as far as the virus is concerned, both genomic studies and large amount of data which has been done, it suggests that this virus is of natural origin. It has mutated, jumped species, and has developed the ability of sustained human to human spread. This has also happened with other coronavirus, like with the SARS outbreak, which was again a virus with jumped species and had the ability for human to human spread. And the MERS coronavirus, which is the Middle Eastern Respiratory Syndrome virus, which is happening in the Middle East, and we have pockets of cases across the world because of this virus for many years. And this is also a virus which is of the corona family, but is jumped species. So it's important for us to understand that this virus is not man-made. It is a virus which has jumped species, had developed the ability for human to human spread, and has become a novel virus for which there is really no immunity as far as mankind is concerned. It's also said that this is a synthesized attempt to sell masks and vaccine, that this is driven by industry, the pharmaceutical industry, and other industry. Again, this is not true. We have a huge number of cases, and this number is rising. A large part of humanity is suffering because of the number of cases, and therefore, this is not an attempt to do sell masks or to create a vaccine. This is a true and present danger, and we need to really worry about this because this is something that is present in the world today, and we cannot take this pandemic lightly. A large number of lives have been lost and are being lost every day as far as COVID-19 pandemic is concerned. The other question comes, are all ages susceptible? And does this new or novel coronavirus affect older age? And are the younger people and are younger people also susceptible? So the issue to remember is that this virus affects all ages. It's seen in neonates also. It's been reported in young children also, middle-aged people also, and in the elderly. So as far as the infection is concerned, it occurs at all ages. The mortality tends to vary, and I'll come to that subsequently. But all ages are susceptible to getting infection with COVID-19, and one should not feel that children don't get it, therefore they can go out to the park and play. That is not true. Children can also get the infection if they go out into crowded places. And what is worrisome is the children can get the infection and bring it home and give it to everyone at home, including the grandparents who can have a serious infection, or to give it to people who have comorbid conditions and it can become a serious infection. So it's very important for us to understand that all ages are susceptible, and therefore everyone should take precautions, whether it's social distancing or hand hygiene, irrespective of your age. The other fear is that COVID-19 infection is always life-threatening. That is also not true. As a matter of fact, in my mind, if we do a detailed analysis subsequently, we will find that its mortality was much lower than what we even are thinking today. That's because we have a large number of asymptomatic cases, so we don't know what the denominator is. But even if you look at the cases that we have, confirmed cases and the mortality, the infection does not cause a very significant mortality. As a matter of fact, there are other non-COVID illnesses which are currently causing more deaths than what COVID-19 is causing. So I think that issue that it is always life-threatening is unwarranted. If we look at the age stratification of COVID-19 amongst different age groups, you'll see that both hospitalization, ICU admission, and fatality is very, very low up to the age of almost 45 to 50. As a matter of fact, it's less than 0.1% as far as case fatality is concerned. The mortality tends to rise when one becomes older. So if we look at people over the age of 60, and then people over the age of 70, and people over the age of 80, then the mortality is higher in them. It can be a serious illness as far as the older age group is concerned. But the younger age group, the mortality is very, very low, and we need not call it a life-threatening illness. So the message here, I think, is that we need not worry. What do we need to worry about is two groups of people. One is the elderly and those with comorbid conditions. What do we mean by comorbid conditions? Those with hypertension, those with diabetes, those with heart disease, those who have poor lungs, chronic respiratory diseases like COPD, asthma. These are the individuals whom we need to protect and make sure that proper isolation, social distancing, hand washing is done, and they are not getting exposed to someone who can give them the infection. For the younger age group, it's important to remember that this has hardly any mortality, and therefore this is not a life-threatening illness. This is again trying to show you the same uh, data, that if we start looking at estimated proportion of all COVID-19 infection that will require hospitalization, you can see that the number is much lower up to the age of less than 50. The number of people who are required to be hospitalized is just 4%. And among them, most of these need only oxygen or supportive care. They don't need any ICU or ventilator care. But then this goes up significantly as the age increases from 50 to 59, from 60 to 69, from 70 to 79, and 80 plus. And this is where you also have a higher degree of mortality, because these patients are more sick and they need ventilatory support. They may be in the ICU. They have other multiple problems which sort of augments the complications, and thereby their mortality tends to be higher. But if you look at it holistically, look at the entire population, then this continues to be a mild illness with not that high a mortality. The other feature is that people argue that I am young and healthy, I don't need to protect myself, my immunity will take care of the virus. Again, it's important to remember two things. One is that young people definitely are having less severe illness, but they can also have a severe illness. But the other important thing to remember is that although they have, majority of them will have a mild illness, they are still transmitting the illness and they are still infectious, and therefore they will lead to an increasing burden of disease as far as society is concerned. More importantly, they will take this illness or this infection to their homes and to people who are not young, who are not that healthy because they have comorbid conditions, and they will cause them, and they are their family members or near and dear ones who will get this infection and who will therefore not have a mild infection but will have a serious infection. Therefore, even if you're young and healthy and you feel that you will be all right, remember that you could be a carrier and take this infection and cause a serious problem to someone who is near and dear to you by not following the norms of infection control and social distancing. So I think it's very important for us, for all of us, to really understand this in totality. Some people argue that lockdown and social distancing are a waste. But let me explain this to you. This is an illness for which we don't have a definitely proved therapy. And what a large number of data over pandemics over the last 100 years, and the biggest pandemic that we had was in 1919, the Spanish flu, which was due to influenza. What really worked there, and this is data to show in different cities, in different continents, is basically lockdown and social distancing. In various cities where lockdown and social distancing way back in 1918 was done aggressively, the number of cases were much less. Those cities which did not follow social distancing and lockdown aggressively, not only did they have an initial surge, but later on also there was a huge surge as a resurgence of disease, as is shown in this graph. So it's important for us to remember that we should consider lockdown and social distancing like a form of treatment to prevent the transmission of this infection from one individual to the other, and thereby this means will break the chain of transmission and prevent the spread of infection. Remember, this virus can spread only from one human to another. There's no other way it can spread. And if we do have aggressive lockdown and social distancing, we don't allow the spread to happen. And if we don't allow the spread to happen, we don't allow the virus to multiply, and we are able to thereby prevent this virus from growing, from multiplying, and thereby decrease the growth of this virus and are able to eliminate this virus. Therefore, these are very, very important steps. And in my mind, social distancing will have to continue with all of us even after the lockdown. Because if we have to deal with this virus on a long term basis, we will have to change the way we are living today, and social distancing will have to become the norm. I know it's going to be difficult, we are not used to it, but this is something that we will have to do post the lockdown. The other question which comes is that I should keep the AC switched off as it spreads COVID-19. Now it's important to remember, how does this virus spread? This virus is predominantly a droplet infection or through coughing, which can stay in the air for a short period of time, and if someone comes in close contact with this person during that period of time, he can inhale the virus and get the infection, or these droplets settle on surfaces, and by touching these surfaces you could get the infection. So if you are using a window AC or a home AC, which is where the air is not circulating in different rooms, then there is no chance that the AC itself will cause the infection, because the AC is either getting air from outside, which is air in the environment, or it is room air which is being circulated. The only concern is if you have a centralized AC where one is not sure whether there is infection in one room and someone is coughing, and that aerosol or that air gets sucked into the AC duct and it can spread to another room and give the infection there. There is no clear cut data about this, but this is a cause of concern, and therefore there is a lot of issue about central AC. But ACs which are in the room, wall mounted ACs or other ACs which are based for a room, are quite alright, and they can be used in that they do not cause COVID-19. But like I said, if you have big buildings where central air conditioning is being done, then as per the guideline, there should be adequate air exchanges so that air in the room is thrown out every hour and it comes, fresh air comes in. You could have 6 to 8 or more exchanges per hour, which would help in making sure that the air inside the room is fresh and it's not, the chance of infection are less. The other feeling that some people have is wearing rubber gloves while out in public effective in preventing the new coronavirus infection. Again, that is not really required, because even if you wear gloves, you could pick up the infection by your gloves getting contaminated, and then that will stay on the surface of the gloves for a long period of time, and you will not wash your hands or wash the gloves because you feel that you're wearing gloves and your hands are safe. And if you touch your face, your nose, your mouth, or any part of your face with these gloves, the infection will get transmitted to your face, and that is how you could again transmit the infection, get the infection. Therefore, I think rather than actually wearing rubber gloves while going out, hand washing is more important. You don't want the virus to be there in your hands at all. So avoid touching surfaces if you're outside. If you can wash your hands regularly with soap and water, if that is not available, use a hand sanitizer. And whenever you come home, you must wash your hands with soap and water, and avoid frequently touching your nose and mouth, because if your hands are contaminated, that is the only way the infection can actually go from your hands to your respiratory tract and cause an infection. So therefore, I don't think wearing rubber gloves will actually prevent you, and it is not an effective measure of preventing coronavirus infection. A lot of concern has been raised over the last few days because of what happened in New York, that should we give up all our pets, they may transmit the virus to us. There is really no data to show this. Uh, there is no evidence that pets such as dogs or cats can transmit COVID-19, and therefore I think we should not really worry about any pets that we have at home giving us the infection. They are not the ones who can transmit the infection, and there is a lot of evidence to show that even people who are infected and who had animals at home, the animals did not get any infection, and neither did they show any symptoms of having COVID-19. So I would advise you that at this time, don't abandon your pets. If you are asymptomatic, if you are symptomatic, you can maintain a physical distancing from pets too, but there is really no indication that pets can give you the infection, and therefore I think this is a myth which we need to really go against and say that this is something that we should not do and allow pets at home. They will actually be able to comfort you while you're in a lockdown situation. So do look after your pets at home. The other feeling is that there is some visual that the novel coronavirus can be transmitted through flies or mosquito bites. Again, there is no evidence to suggest that this virus could be transmitted through flies or mosquito bites. As a matter of fact, this is not a vector-borne virus. This virus doesn't go through any vector like we have as far as dengue or chikungunya is concerned, which are vector-borne viral infections. This is a virus which is basically a respiratory tract virus. This is through airborne particles, and like I said, it's through droplets generated while a person is coughing, sneezing, or through his saliva or nasal discharge. And these droplets stay in the air for some time, create a little bit of an aerosol, and then they settle on surfaces. And the virus can survive on surfaces for many hours. And by touching those surfaces, the virus can come onto our hands, and then if we with these hands we touch our face, it can come onto our face and cause the infection. Therefore, hand washing and social distancing are important. But this is not true that flies or mosquitoes can give this infection from one person to the other. This is actually a myth, and there is no evidence to support this. Then there is a feeling that if I bathe in hot water twice a day, I will kill the virus. Again, there is no evidence to suggest that taking hot bath will prevent COVID-19. As a matter of fact, again, the best way to prevent COVID-19 is to clean your hands properly so that there is no infection on your hands. But by saying that I will take a hot bath and I will not get COVID-19, not true. Often, if you use a very hot water, you may actually cause more harm than good. And therefore, I don't think this is true at all, and we should avoid doing this as far as taking hot bath twice a day is concerned. Then some people feel that can gargling mouthwash protect you from infection with the new coronavirus? Since we say this is a throat infection and this infection occurs in the nasal passages and the throat, some people argue that if I gargle my mouth with antiseptic solution that will kill the virus and I will be all right. Again, it's important to remember that this is a virus in the throat which is inside your cells, it's inside the body cells. So gargling your mouth with antiseptic is only going to be on the surface. The virus is no longer on the surface of your throat. It is now deep inside your cells, and therefore gargling is of no use, and therefore there is no evidence that this can protect you from novel coronavirus, and therefore mouth washing is not an accepted modality of treatment. Similarly, people think that drinking very hot water will kill the virus using the same theory that if I take a lot of hot water or do gargling with vinegar and salt, I can ward off COVID-19. Again, that is not true. Like I said, once you get the infection, it goes inside the cells, it goes inside the cells of the body, in the throat and in the neck. And by doing gargling or drinking hot water, you will not be protected, or you will not be able to kill the virus as far as COVID-19 is concerned. Some people are very, very wary, and this has happened because of some news items also, that is it safe to receive a letter or a package from China or from a delivery boy? Again, these packets that you get through from long distances are very, very safe because COVID-19 cannot survive on objects for a long period of time, and therefore the virus will, even if it gets onto these packets, will die during the time that it is being sent to you over a long distance. Even if you have someone coming into your house, a delivery boy, it's important that social distancing be maintained. There are various ways of having a delivery where there is no contact. The person can leave it outside in your house and then go away, and then you can pick it up when he is not present there. That can easily be done. You can, once you pick up an item, wash your hands so that it doesn't really come onto your hands. And a box which may be contaminated can be thrown into the dustbin so that that doesn't cause any infection. So taking delivery is safe, and one need not panic or worry about taking delivery, whether it be from packages which are coming all the way from China. Some people feel that I'm a smoker and smoking can protect me against viral infection and severe disease. I think it's the opposite. Smoking has a risk factor. Smoking causes many diseases. It can cause more than 10 cancers. And smoking weakens the immunity of the lung and may actually lead to more severe infection as far as COVID-19 is concerned. Therefore, smoking does not protect you against COVID-19. It may actually cause more harm than good. And I would say that all people who are chronic smokers should use lockdown as an opportunity to give up smoking and try and see whether using this lockdown period they can do something which may be useful for their health in terms of smoking cessation. Similarly, some people feel that drinking alcohol will kill the virus in our throat and prevent infection. Here, the theory seems to be that since we use alcohol rubbed on our hands to kill the virus on the palms of our hand as hand sanitizers, if we do the same thing in the throat, we will kill the virus. On our hands, the virus actually stays on the surface. It doesn't go into the cells of our palms, and therefore, by using a hand alcohol-based hand sanitizer, the virus dies. But in our throat, the virus has actually gone into the cells. It's not on the surface, and therefore, drinking alcohol or doing gargling with alcohol will not protect you from the infection. Again, it can actually cause problems as smoking does, of increasing your health related problems and increasing, if you have a binge of alcohol, it can lead to aspiration pneumonia, and chronic alcohol intake can lead to a large number of problems, including liver diseases. And therefore, I think alcohol consumption again is not something that we should encourage. A lot of people feel that herbal and homeopathic remedies will protect them against COVID infection, and this is something they keep asking that should we try this? There is really no evidence that herbal, Ayurvedic, or homeopathic medication can protect against COVID infection. Remember, this is a novel virus. This virus did not exist before the end of last year, and therefore, whether these treatment strategies like herbal treatment or homeopathic treatment will be effective is something which we don't know. We don't have any evidence to support it. Therefore, I will not say one way or the other, but current evidence does not show that any herbal or homeopathic remedy can protect or cure you as far as COVID 19 is concerned. In terms of diet, one should have a good balanced diet. Fresh fruits, green leafy vegetables are good for health. We should take our normal healthy diet because that will help. Also, there is no proven immunobooster that will protect you against COVID. People keep arguing that should I take vitamins or others. Really, no evidence to suggest that. Some people argue that my colleague in office has COVID. I talk to him via phone. Will I get infected via the wireless network? This actually does not hold true at all. The virus is something which goes only through aerosol or through contact, so it can not travel on radio waves or mobile network, and it is not spreading in through the network at all. One should again remember that this is a respiratory droplet infection. But having said that, it's important that you clean your phone because your hand keeps touching the phone frequently. And like I said, if your hands are infected, that infection can go onto any surface, including the surface of the phone. And then if someone borrows your phone, he can get the infection. So it's important to keep your phone clean. You should regularly clean your phone with an alcohol-based hand sanitizer. And again, hand hygiene is very important. If you're using someone else's phone or even your own phone, please use a hand sanitizer or wash your hands regularly when you come in contact with such objects. The other issue is simple homemade masks, medical or surgical masks are ineffective, and the virus is at too small, and these are large pores, and therefore it will not work, and only N95 will work. So many people, especially those who are not working in healthcare facilities, insist that they should have only an N95 mask. That is true that the virus is very small, and you need to really can't see it with the naked eye. But the virus is transmitted from one individual to the other to what we call droplet infection. These are large drops which are released when we cough, when we sneeze, or at times when we speak loudly. And these droplets, when they are released from our nose or mouth, can be stopped by simple masks also. And therefore, in individuals who are not working in healthcare facilities, the common man, a simple cloth mask is effective so that you, if you have mild infection or you're asymptomatic but have the infection, If you cough or sneeze, you will not allow the virus to travel out. Even if it goes out through these masks, it will not go for a long distance, and you will therefore contribute in preventing the spread of infection. But make sure that the mask fits tightly around your face, especially around the side of the face, because sometimes the air tends to leak out from the side. It should be secured, and it should allow you to breathe comfortably. And in a cloth mask, you can wash it, you can put it in the washing machine and dry it out in the sun, and then you can reuse it as long as it is not damaged. So cloth masks are something that can be used. Homemade masks are something that the general public can use. As far as doctors are concerned, they should actually, depending on the where they're working, they would have to use the medical or the surgical masks, including N95, depending where they are working. Some people argue that wearing an expensive mask will give me 100% protection. Again, like I said, that N95 masks are needed only for healthcare settings. Ill-fitted masks will not provide good protection because air will go in from the side of the mask. You will breathe air in from the side of the mask, and the virus can also go in from that side. And if you have a mask which is very tight or it's not properly adjusted or you're uncomfortable with, you will keep touching that with your hands, and thereby you are more prone to causing infection. And therefore, I think you should be careful about the mask you use. In my mind, for the lay public, a simple homemade mask gives enough protection, and that is what we need to use. Some people argue that if the virus is exposed to temperatures over 26 to 27 degrees, it will be killed and it does not live in hot region. And like I said, if we stay out in the sun, we will be able to get rid of the infection. This is not true. This is actually a myth. This does not happen. The virus is transmitting itself in tropical countries. We have outbreaks in Singapore, in Brazil, and therefore temperature even more than 30 or degrees centigrade or closer to 40 degrees centigrade also has shown that the virus transmission does occur. Another question: can regularly rinsing your nose with saline help preventing the infection with new coronavirus? Again, there is no evidence to suggest that this is effective, and therefore this is not an effective form of treatment, and therefore there is no strong evidence that this could help you as far as COVID-19 is concerned. A lot of people are saying that summer has come, and now summers where we have a very hot temperature in India will kill the virus. But again, like I said, two things we need to remember. One is that there are areas where the temperature continues to be hot and humid in the world, tropical countries, and viral infection or virus transmission is still occurring in them. Second issue to remember is that very often we live indoors, and indoors the temperature is usually under air conditioning. Temperature is usually in the 20s, and whether it be our office, the shopping mall, and if someone is coughing or sneezing there, the virus can still spread itself out there, causing infection. Therefore, I think even if we have a hot summer, we still will need to take precautions, whether it's social distancing or hand washing, to prevent the transmission of infection. And it's unlikely that the Indian hot summer or the heat wave will actually kill the virus. Similarly, people feel that exposing myself to sunlight will kill the virus. Again, this is not true. Exposing yourself to sunlight or staying out in the sun does not prevent COVID-19, and therefore one should not really look at this as a form of treatment. Some people argue that the medicines that they buy, purchase medicine, should be kept in sunlight for an hour and to kill the virus before using them. Again, it's important to remember that although sunlight inactivates viruses in general, and that may work, this is really not needed, and you can just clean it with clean the outer package if you think you're very worried. Also, when you bring the medicines home in an envelope, discard it and just keep the drug strip with you inside, so that whatever handling has been done with the envelope rather than the medicine itself. Also, keep in mind that exposing medicines to sunlight may make them ineffective or dangerous because they will interact, and that is not something which the pharmaceutical industry advises, because many drugs will get inactivated. So this is not a good strategy of keeping all your medicines in sunlight for an hour. It may actually cause more harm than good. Some people argue that they've taken flu vaccine or they've taken the pneumococcal vaccine, and therefore, since this viral causes flu-like syndromes, they are protected against COVID-19. It's important to remember that this is a different type of virus. This is a coronavirus, whereas the other virus is either influenza virus or it's a pneumococcal infection. There is no cross protection that occurs between this virus and influenza virus. Therefore, taking the influenza shot will not prevent you or will not protect you as far as COVID-19 is concerned. You will still have to take all the measures that we've been talking about if you want to protect yourself against COVID-19. The flu shot is not protective as far as coronavirus is concerned. Some people feel that I have COVID infection, I'll have it for life, I am doomed. Again, this is not true. Majority of patients, and I've shown this before, majority of patients, almost 90 to 95% of patients who get COVID-19 will recover fully. And therefore, it does not mean that you will have the virus for life. As a matter of fact, you will recover and you will develop some immunity which may protect you from getting the infection again. So therefore, the issue of having COVID infection and having it for life is not true. As a matter of fact, you will have immunity which will prevent you from getting it repeatedly, and even if you get it subsequently, chances are that it will be a much milder form. Therefore, we need not panic if we are positive as far as COVID-19 is concerned. People feel the future is gloomy, mankind is under threat. We keep seeing what is happening in the media, and we feel that this is something that there is no end to. But it's important to remember that if you look at various pandemics which have happened in the history of mankind, this pandemic is much lesser than what has happened, whether you look at the number of people who've been affected or who have actually died, whether it be the plague or whether it be smallpox, the Spanish flu, HIV/AIDS. The number of people who died currently as far as COVID-19 is concerned is much smaller, and thereby in terms of other outbreaks or pandemics, this continues to be much lesser in terms of mortality or number of cases affected. It's only that we are currently more aware of it because of media and because we get the news, global news, very, very quickly. 50, 60 years ago, this was not the case. Pandemics would happen. We had a huge pandemic in 1980, and it did not create as much panic or as much news as is happening today. So a lot has changed in 100 years. But in terms of its magnitude, this pandemic is still not of that magnitude as was seen at that point in time. So we are facing a big pandemic. We are seeing a large number of cases. But as compared to what it was 100 years ago, we are better prepared. A lot of research is going on to develop new vaccines, new drugs. New therapies are being developed. The global community has come together as far as research is concerned, as far as trying to inform each other as what is the best strategy as dealing with this pandemic is concerned. And I think we have made huge progress over the last 100 years since the 1918 pandemic, and we are definitely better prepared as compared to what it was 100 years ago. As part of that, a lot of things have happened. We have now changed our lifestyle. We have virtual musical festival. We have AIMS is providing teleconsultation to patients rather than having a physical consultation. And there are a lot of other solutions that the ministry is also looking at. So as the virus adapts to us, we are also adapting and changing. So I do agree that we will have to change our lifestyle because of COVID-19, and that is what life is all about. That as things happen, mankind does adapt and change and actually comes out stronger with any hardship that it faces. One question that came up was that taking multivitamins, vitamin C or vitamin D will protect me from COVID-19. Again, no evidence to support this, and we should just take a good balanced diet. What about the future? And I'm just going to have one slide as far as this is concerned because this is evolving. But the life post-lockdown 2.0 will not be back to normal as it was 3-4 months ago. We will have a new normal. We will have to really adapt to social distancing, to regular hand washing, to wearing a mask, and we will have to see how we can change as far as academic activities are concerned. We can't look at an activity for the next few months where teaching will be in crowded classrooms. because we're always concerned about the spread of infection there. We will have to look at more technology to help us, and therefore, what we can do for the future is, from the academic point of view, we will have to look at new teaching curriculums, new way of teaching, looking at net-based teaching. We will have to look at how we can look at new areas of research, whether it be infection control, whether it be new drugs or new vaccine. Society-wise, we will have to change our way of living. Uh, there will be a cultural shift as far as many activities are concerned over the next few months or years. And I think this will have a major shift as far as the economy is concerned. Some sectors in our economy will boom or do better. Health-wise, there will be a shift, and there are other economies which will face a challenge because of the fact that, because of social distancing and the fear of not of coming together and transmitting the infection will cause problems. So I think all of this will actually be something that will sort of evolve over the next few months or years, and I think we will have a new normal as far as society and this world is concerned. But I'm sure that all of us are very good at the change and adapting, and that is what Homo sapiens or humans are all about. We will change as the need arises, and I'm sure we will overcome this COVID-19 infection and come out stronger and in a more positive manner. Thank you very much.
Good afternoon, hello, and welcome.
Um, yeah, good afternoon, everybody. After a very comprehensive talk by Professor Guleria, we've received a lot of questions, and thank you for the enthusiasm. While we collate the question, one of my queries as a healthcare professional myself is, sir, there's been a lot of stigmatization of the healthcare workers, and there is a fear among the community that they are spreading the disease when they go from hospitals, despite the fact that they take a lot of precautions to not get themselves infected. Would you like to give a message to the community how this stigmatization should not happen?
So I think it's a very important message that we need to give. The most important thing to realize is that healthcare workers actually risk their own life and the life of their the effect it can have on their family when they start working in hospitals, both in COVID positive areas and COVID negative areas, because you never know when a patient may be COVID positive. They take all precautions, and there is really no data to suggest that healthcare workers take the infection and spread it to the community. As a matter of fact, if they were to spread it, they would then be spreading it to their own family members. And therefore, this notion that we should stigmatize or put healthcare workers away from our locality or from our own place of stay is actually wrong. It's demoralizing for those who are actually uh, putting their life at stake so that society can survive and do better. And I would suggest that we should all come together to support them, not only them and their family, in this trying times where we are trying to fight a pandemic. So I think this is a very important thing that we need to keep in mind.
Yeah, that's true. Sir, and what about the people who are there's a question that they've asked is that for example the pregnant women they what is the effect of coronavirus on pregnant women, and will the infection, if the woman gets it, will it impact the baby, and will it get transferred from mother to the child?
So first of all, there is little data, limited data as far as pregnancy is concerned, but really none of it supports that pregnancy is a risk factor as far as COVID-19 is concerned. Remember when we had the pandemic H1N1, what was known as swine flu, pregnancy was a risk factor. But for COVID-19, as far as the current data, it is not a risk factor for developing severe disease. Also, there is really no data to suggest that it causes any malformation in the newborn or affects the newborn, even if there is COVID-19. And transmission of the infection from the mother to the newborn in terms of the child getting COVID-19 has not been shown. So I think pregnant women need not be worried. We do test them to make sure that they are negative. but there have been pregnancies and deliveries both in our hospital and in many hospitals across the globe with very good outcome. So it's not a cause of concern.
So the next question is from Asta Divan. It's a very relevant question. So there's a lot of non-COVID issues for which the patients need to visit hospital. So she asks, if a senior citizen needs to visit the hospital for medical problems other than COVID, what are the precautions that such a patient should take? And I would add, what are the precautions other patients who have heart disease or are diabetic and need to come for hospital for those managed? What should they take? Because they're very scared of coming to hospitals right now.
That's true. And I think this is one group, that is what I call the non-COVID patients, who are also suffering a lot because of COVID-19. And therefore, there is a need for us to reach out to these patients. Many of them have chronic illnesses and they need close monitoring, whether it be their blood pressure, whether it be the sugar control, or it be other issues like their own medication, like inhalers, or other day-to-day chronic medical problems. First of all, especially the elderly and the high risk group need to be careful. And therefore, try and see if you can really do something like a tele consultation, which a lot of hospitals have started. AIMS has also started that. So that will save you the chance of having to come to a healthcare center and having that risk. So try teleconsultation first. Try and see whether you can go on and log on and try a teleconsultation. If that does not work and you have to definitely come to the hospital, make sure that there is social distancing. You have to wear your mask when you come to the hospital. You have to regularly wash your hand, avoid touching surfaces, and make sure that you are coming in an area where the crowding is not there. Most hospitals are developing strategies to make sure that the non-COVID patients are looked after and they're protected so that they don't have the risk of getting infection. As you mentioned, elderly, those with chronic diseases like diabetes, hypertension, and others are high risk for developing severe infection, and we have to take all measures to protect them.
So, sir, related to that, Lata Narayanan is asking whether a herd immunity could protect people in India.
So it's an important question because there is a whole feeling that herd immunity may be the answer. So how can we develop herd immunity? Herd immunity can occur if a significant number of the population gets the infection and recovers from the infection, and therefore there are antibodies in their blood which will prevent subsequent infection from happening, and that would mean almost 40 to 50% of the population at least. Or herd immunity can also occur if there is an effective vaccine and we vaccinate everyone so that they get the immunity through the vaccine. Now the issue is that we need, considering the population of India, it will take a long time for this herd immunity to develop. Second is, we don't know how long this herd immunity will last, because there is some data emerging from other countries which we need to look at in great detail regarding reinfection occurring in people who have been recently having COVID-19. If that is happening, that means the immunity that we are developing is not lasting for long, and that may be a cause of concern. But for most viral infections, they come down over a period of time because of the development of herd immunity, as we've seen with the H1N1 on swine flu.
Yes. I think we have a lot of people from the colleges and the students. One of the questions by Mr. Nirmal Kumar is that once the lockdown is lifted, how do we ensure safety in colleges and how do we meet students and other colleagues, because there's a lot of gathering in colleges. How do we go about that? Can they be back to normal?
So it's going to be a big challenge, and I personally feel that when it comes to academic activities, we will possibly develop a new normal for many months or years to come until we have that so-called herd immunity and we feel it's. And therefore, education itself will change, and we will probably look at using uh, telemedicine or teleconsult or the electronic media as far as education is concerned, teleclasses, and using that to really communicate. We will have to maintain social distancing. Wearing a mask while you're in college would become, I think, a norm. Hand washing would also be something, and social distancing will become important. So how to really do that in a crowded classroom and be able to teach, especially considering that there are some practical sessions which are required, is going to be a challenge. And I think over the next few months, colleges, educational institutes will become more innovative in developing strategies to meet this challenge.
Yes, I think we all have to, in college, we'll have to gear up for some new kind of education. Sir, Richa Mishra asks, what kind of surfaces? So there are variable reports about coronavirus spreading through surfaces. So what is what is a good some resistant kind of a surface that is possible? I mean, so what are your views regarding that?
So surfaces are something that is a cause of concern because, as we also said in the talk, that one of the causes of the transmission of this infection is by it surviving on surfaces for a long period of time. And it's been shown in experimental studies that this virus can survive for many, many hours on metal surfaces, on cardboard surfaces, on plastics, and therefore that is a source of transmission if we touch these surfaces, and that's why we always keep stressing upon hand washing. The virus has the capacity, especially if the temperature is not that high and there is humidity, that it can survive on external surfaces for many hours, and we need to be careful about the surfaces that we touch. Uh, my own take would be that whenever you avoid touching a lot of surfaces and keep washing your hands regularly.
So we have some doctors also seeing this webinar. So Dr. Mahamre, I think he's asked when should we start operating? What is the good time as an orthopedic surgeon? We could go back to doing elective surgeries.
So I think this is a big challenge as to elective surgeries. It depends on many factors. One is, of course, the lockdown. Once it's lifted, you have patients who are willing to come. Confidence in patients that they can come to the hospital for elective surgeries. I know a lot of patients are reluctant right now to come for elective surgeries. And the whole staff, which includes the anesthetists, the nurses, and the surgeons, feeling comfortable about operating such patients. I have I know that a lot of surgeons are wary because they feel that every patient should be tested before they take the patient up for surgery. The anesthetists sometimes feel the same. So we will have to develop different strategies for elective patients. We may not need to test everyone, but we will have to see how we can screen them. In my mind, even now, if everything is in place and you have a non-COVID center with proper infection control measures in place, you could look at doing elective surgeries even now. That there is no real contraindication for doing elective surgeries if the facility is there. But like I said, you will have to look at different strategies as far as infection control is concerned, keeping in mind that you have a pandemic of COVID-19 going on.
So, Nimisha Sinha asks, what exactly is asymptomatic corona infection? And is it a new threat or some different strategy that is required to cope up with this? And I'm going to combine this with another question from Praful M19. And he asks that if plasma therapy is the answer for the disease, and with all the mutants coming in, like what is the real strategy that you
So
people are
two
using?
things. One is regarding asymptomatic individuals. So initially it was felt that individuals who are having COVID-19 will have some symptoms and they should have fever, sore throat, cough, and then only would you be able to diagnose COVID-19. By and large, that is true. But over the last few weeks, we've also realized that there are some individuals or a significant number of individuals who have mild or no symptoms. You may have just a mild fever, which is less than 99, body aches, a little bit of irritation in the throat, and you would feel this is just related to the climate change or sleeping in the AC for a long time and getting some exposure. But this could also be a feature of a mild COVID infection, and it will improve in the next few days. So we have now realizing that COVID can also cause a very mild or no illness, and this is a cause of concern because these individuals will never come forward for testing. We will never test them like we are doing symptomatic individuals, and they can still be carriers or transmit the disease. Because of this, two strategies have become very important. One is aggressive lockdown, especially in hotspots, where you restrict movements not only of symptomatic people, but even asymptomatic individuals who may be spreading the disease, and that is why the lockdown becomes more and more important. And secondly, wearing masks when you're in public space, because masks will protect not only you but also prevent the transmission of disease. So let's say a person
is an asymptomatic individual, but he's infectious. He can spread the infection. If he's wearing a mask and he's talking loudly or he just coughs, the mask will act as a barrier and will not allow the infection to go out into the community and not let it go on to another individual. So, if everyone was to wear a mask, even the asymptomatic people will not spread the infection to others. Therefore, one should wear a mask. If you're symptomatic, you should definitely wear it. But if you're asymptomatic, you should also wear it because you will also be able to contribute to preventing the spread in the community.
I think that's very relevant. So, because and in the pre-symptomatic stage, also you could be shedding.
Correct. And you rightly said that it's also emerged that even if you develop symptoms, about 2 days before you develop symptoms, you could still be infectious and you could still be having virus in your throat and you'll be spreading it. But 2 days later only will you develop fever and classical symptoms of COVID-19.
Right. So another question is related to by Ruchi Gulati or related to disinfectant, which says there's been massive use of these sprays in public places. How effective and are they, and will these chemicals not impact us otherwise? And I'll add a question to that, which is, from where it comes. Should people be ingesting and injecting disinfectants?
So first of all, a lot of spraying is done more for allaying fears, if I put it that way. The main important thing to remember is that as long as you wash your hands, the surfaces may be infected, and whatever spray you do may miss out on large part of surfaces which are indoors or which are not sprayed properly. So disinfectants may be useful and may help in decreasing the so-called viral load if it is there in the environment. But hand washing is very important because the infection can only reach you from those surfaces through your hands and then your hands touching your face or your nose and mouth. So therefore, hand washing becomes the most important step to break the chain of spread from these surfaces. There is no evidence that ingesting or injecting yourself with disinfectant will work. It could probably cause more harm. It will cause it call corrosive injury to your esophagus and your gut. So I think it is too dangerous and it's a health hazard. So please even don't consider it.
Thank you so much for that. Nitika Kaushal, I'm going to combine two questions again from Nitika Kaushal and Surbhi Agarwal. And Nitika asks if there are any instances of cross protection due to regular flu amongst Indian population. And Surbhi asked if what are the therapies other than the plasma therapy that are being tried.
So I'm sorry, I forgot the one part of your previous question about plasma therapy. So I'll combine it right now. Plasma therapy is just one form of therapy, and plasma therapy is not a new therapy. Plasma therapy has been around for about 100 years or so. It was used also during the Spanish flu or the influenza pandemic way back in 1918, and it's been used for a large number of diseases for which no treatment was available at a given point in time. The polio outbreaks, and more recently, it was also used for Ebola patients. Its philosophy is very simple. A person who has an infection recovers by the body producing antibodies against that infection and thereby uh, taking hold or killing the infection and becoming all right. These antibodies are present in the blood. So if he was to donate 1 unit of his blood and you were to extract the plasma from that, and if you were to show that this plasma has good amount of antibodies, then by giving this to a sick person with the same disease, you could be able to cause some degree of passive immunity in that person. But this is just one form of therapy. If you look at the pathophysiology of COVID-19, it causes a lot of other things, which we are just learning. It causes infarction or clotting in various parts of the body, in the lung. There's now some suggestion that it can happen in the heart, it can happen in the central nervous system, strokes can happen. Also, there is what we call a cytokine storm. The infection leads to a large increase in various inflammatory substances in the blood, and they cause more damage as a response phenomenon. So, when we look at plasma therapy, it's just one form of treatment which is part of a whole treatment strategy that you have to have. It's not even very clear how effective it is or important it is. So, it's not a major treatment strategy or a major game changer if you start looking at the management of COVID-19. Do other vaccinations provide you cross protection? Possibly not. influenza virus is different, and therefore there is no way that influenza virus and COVID virus are different families. They will not protect or provide any cross protection. So previous immunization, whether it's from for pneumococcal or influenza, do not provide you any protection as far as COVID-19 is concerned.
Right. So the next question is by Purnima Bhardwaj, and she says, as we discussed, there are a lot of asymptomatic carriers. So should everyone get themselves tested? And the other question is, what is the role of Arogya Setu app in prevention of spread of the pandemic?
So two important things. One is, since we have a large number of asymptomatic people, they don't need not worry, since they are not going to get a serious illness. But they are individuals who can spread the infection in the community, and therefore we need to be careful about how we practice infection control. Testing everyone is not a solution, because you may be asymptomatic, may not have the infection today, and 5 days later you may get exposure and have the infection. So we can't say that you should test everyone every week or every 5 days because of the ongoing pandemic. Therefore, testing asymptomatic individuals really will not make much sense. It could be done either symptom based, or in a very say a hotspot, where you want to look at, is there some do you need to isolate people in the community, but it doesn't really have a lot of sense in doing it in a large base. Arogya Setu is a very important app which the government has introduced. It helps to diagnose for you to it's helps you to be able to diagnose your symptoms and see whether you are at a risk for developing COVID-19. It also tries to map everyone around you and tells you if you are in an area which is a hotspot, or you come in contact or close to a person who may have the infection, and therefore it helps to protect you against coming in close contact with someone who may be infected. So it's an app which will help you in a big way as far as the fight against COVID-19 is concerned.
And the more the people join, the more successful
So
the
the
app
success
will
of the app relies on everyone being part of it, because then only will the database be strong enough to really warn you of people who may have the infection and may be close to you.
Yeah, so I think we all should download Arogya Setu app. Sir, there's a question from Akansha Saxena, who asks that now there are recent reports which say that virus is spreading through air pollutants. So, what are your views on that?
So there's really not much evidence that pollutants or in the air, the virus tags onto pollutants and therefore spreads for a long time. The virus itself actually cannot travel in the air for a very long time, and that's why it quickly settles down on surfaces, and its transmission starts occurring through contaminated surfaces when we touch these surfaces. Therefore, the impression that pollution will be one of the factors which will lead to transmission is probably not true. As a matter of fact, because of the lockdown, the levels of pollution have come down like never before. We've had really blue skies and very good environment for the last few weeks, thanks to the lockdown and decrease in the traffic and other industry, which was the cause of a lot of air pollution.
Yeah, that's true, sir. And we can.
One question just come in and might be relevant is, what chemicals are useful in sanitizing in and around our homes? I think bleach and
So, bleach-based chemicals are useful for your hands. 70% alcohol is another hand sanitizer that you should use. But the standard chemicals that you use. So you must also remember, this virus is nothing. It's not a very hardy virus. It can survive for a long period of time. So bleaches or any other good antiseptic that you use will kill the virus quickly, and therefore can be used. But like I keep repeating myself, also remember that before you do any such activity and after you finish such activity, regularly wash your hands properly and wash them for at least half a minute, taking care that you wash all parts of your hands.
So we do have a lot of questions, but we are now short of time. So one last question quickly: whether it is worthwhile? I mean, should we wash all the packaged material, and how safe they are? For example, milk packets that we get. So whether they should be washed, and obviously we cannot wash bakery products. So what do we do? There's a huge paranoia around it. So if you could throw a light upon that.
So a lot of products which come are safe. Bakery products are baked, and if they're packed properly, The issue is a lot of fear regarding two things. One is the delivery boys, and the secondly is the package which comes either through courier or through the delivery boy. So you can have a non-contact mechanism of delivery where the person can leave the package outside, and once he's gone, you can pick it up. So there is really no contact and social distancing is maintained. If it comes in a package outside, take that out and dispose that and put it in the dustbin. If you are really concerned and it's a package, you can again use a disinfectant and clean it. But again, wash your hands after doing that. And once you've done that, you can move it from what is called as a unclean area to a clean area. And once you move it to a clean area, then you can move it inside the house. So you can develop strategies inside your house of how to get things which come from outside, see that they're properly clean, wash your hands after it's done, and then move them inside. But I think by and large, most packages or packets which come are really safe, and it's more of a fear that we have rather than they be actually effective.
Okay, thank you so much, sir, for clearing our doubts and for giving us time. And I know you are very busy. So, with this, we'll stop for today's webinar. Please join us again for tomorrow's webinar, where we will be joined by Professor Nand Kumar from the Department of Psychiatry, who will be helping us to ease a bit of our mental stress during this lockdown period. Thank you very much and have a good afternoon.
Thank you.